All right, we're going to get started here. Welcome, everyone. Thank you for joining us. This is the Rockefeller Foundation's Communications Community of Practice webinar series. We've been looking forward to this session for a while, so I'll try to be as brief as possible with an introduction to this series for those of you joining for the first time. If you're comfortable, please feel free to drop your name, city, and organization into the chat. We'd love to know who you are too. My name is Nina Chung. I'm a senior associate at Hadaway Communications, and I'm joined by Caroline Jaros here behind the scenes. And we and our team at Hadaway serve as the secretariat for the STAT communications community. This grew out of the Foundation's State and Territory Alliance for Testing, or STAT, a closed group convened by the Foundation so that states had a place to truly collaborate and share hard-earned lessons on everything related to the pandemic response. So since launch last fall, STAT has grown to over 40 actively participating states learning from each other about operationalizing testing programs, rolling out vaccines, reopening schools, etc. We wanted to bring that same spirit of active collaboration to the subject of strategic communications. And this is because, as you probably know if you're here, strong communications is absolutely critical to earning the buy-in and trust of our communities for public health. So our aim for the series has been to share the insights of leaders who've been doing this work in creative, scientific, rigorous ways across the country. So with that, I am so excited to introduce our guest today, speaking about equity in our communications and community outreach. This is a topic we've touched on before in previous sessions, but today we have the chance to address this directly, to hear what equity means, not just in intention or in our statements, but in our actual practice as communicators. So we're joined by Ifeoma Ike, a first-generation activist, artist, attorney, and founder CEO of Pink Cornrows, which is a public policy and communications firm building equitable values into every sector. Aurora Harris, the Southern Regional Director for Young Invincibles, based in Houston, Texas, where she leads programming and policy on issues spanning education, healthcare, civic engagement, and more for the area. And Tia Thomas, a Baltimore School of the Arts alum, and a design apprentice at Wide Angle Youth Media, a digital arts education organization. As a very last housekeeping note, please feel free to leave comments, responses, reactions in the chat box and questions in the Q&A box, which we are monitoring throughout the session. And even feel free to leave, a little description of a current situation you might be experiencing related to equity or specific communities. If we have time, we would really love to workshop that with you, and our speakers are really open to talking about anything. So thank you again for being here. And with that, I'll hand the mic off to Ifeoma.
Great, thank you, Nina. Thank you, Carolyn, and Tia and Aurora for being here. Really excited to be with you all today. As Nina mentioned, my name is Ifeoma Ike. Everyone calls me Iffy. That's IFY if you put it in the chat. I do not respond to FE or multiple Fs and Is and Es, but if you want, please feel free to send us messages. And on a more serious note, as Nina mentioned, we want to have this space be more about how we collaborate in problem solving. And not how we dictate one formula as to that can be applicable to all communities. I am proudly a first-generation Black femme advocate who also ensures that our space holds the expertise that comes from marginalized communities. And so in a lot of ways, the conversation that we're having today comes with that experience and that lived reality. But as Nina mentioned, we are open to talk about other communities that our research and our insights have also shared in the midst of not only this current pandemic, but other works that we have done. And again, when sharing questions, we invite you to please also ask Tia and Aurora directly, who are experts that we have heard from and worked with in the past and continue to learn from as we move forward. And so as I share my screen in a playful way, calling this conversation, The Solution Will Not Be Televised. For those that know the infamous Jill St. Heron statement, the revolution will not be televised, for us to really think about the spaces where we think authentic information and communication actually lives, and for us to kind of share some of the insights of some of the practice and the work that we are engaging currently with the Rockefeller Foundation's Equity First Vaccination Initiative. But we actually want to give a little bit of framing first before we move forward. So I want to start with, since we are here with communication specialists, for you to kind of think about what you would say to 3 different narratives that I want to share with you. So the first one happens to be an elderly neighbor at my local hair salon. I walked into the hair salon, this was before I chopped all my hair off, and I was excited to get these braids, and she had, the conversation around at that time, impending vaccination was coming through. I was excited because I knew that spaces like the Rockefeller Foundation and other peers of mine were being requested to give equity insights. And I sat there in my chair waiting for the necessary pause, because that's what you got to do when you're sitting at the hair salon. And I waited for my pause to be able to share why we should take this vaccination. And in the midst of hearing the different opinions around the vaccination, there was an older woman, a senior community member, who walked in and shared about the several experiences that she had and that she had witnessed during her time just here at that time in Brooklyn. And I had shared with her, but our people are the ones that are being impacted by this pandemic more than any other community. And she immediately stopped me and she said, when have our people ever been the first ones to get something that could save us? And there wasn't a catch to it. And I paused because it wasn't about anything I had to say at that moment. She challenged me with a question. And so I'm just throwing that back to this community as to, if you were to meet her, what would you say to her? The next person is a prominent doctor and her son, who is actually a very well-known doctor and does quite a bit of conversations around mistrust, distrust in this space. And she had stated that when she first heard about the vaccination and the communications that dealt with trusting government and medical spaces, the first memory that came to her mind was when her son had an abscess, and she took her young son to the doctor, and they proceeded to do the procedure without giving her son painkillers. And that immediately changed how she felt the relationship between her and doctors as a medical professional, how that felt like a violation to both her understanding of how care was supposed to be, but also what it meant for her as a Black woman who had a Black son, who also recognized that care was not equitably given to her son, or even the consideration that he would be in pain during that procedure. So my question is, what would you say to a mother who has experienced that type of violation about the vaccination? And the final one comes from community members within the space that I live in Brooklyn, New York, who have who have blended families that also are unsure about how they can go and receive information about vaccination, but also have these other real health and social concerns, some of which are outside of COVID, such as asthma, which was reported a couple weeks ago, which is still a major issue in certain areas where environmental discrimination is still occurring. And then moving all the way towards concerns about police encounters. So I put that there just because when we talk about this pandemic, what often happens is we come in starting with statistics, we come in starting with who's dying the most. And in many communities, that's actually not a secret, but we don't come in talking about the intersection of the realities that people are experiencing before and were experiencing before the pandemic, and how those situations have not changed as a result of this pandemic. And if anything, they either continue or have been exacerbated. So as we go through this conversation, Some of the things that Pink Cornrows supports in our advisement with various spaces is when we're thinking about what it means to be equity first, right? About comms during COVID. Some top lines that have emerged that we'll dig a little deeper in the following slides and in the conversation with Aurora and Aurora and Tia include how, number one, how we bridge history with truth and not shy away from its ugliness, how we continue to highlight the realities of today that are persistent, how we redefine who is an expert, moving away from reporting to a space of advocacy and activism. And I even said disruption here, which I hope we get some questions about, because that may even feel like a violation for those that are true hardline journalists and how to report the news. But I throw out the question that if more activism from spaces of communications would result in saving more lives, would you do it, right? And then also questioning the industry's intent. And oftentimes we don't talk about that as much. When we talk about systemic oppression, we often are talking about the criminal legal system. We are often talking about government. We are often at times even talking about healthcare, but we don't talk as much about communications and communication as an institution. So 2 questions that we raise is, number one, why does this story matter to our institution? And the follow-up is, does this story matter in the same way to the communities that we are reporting? So just putting that out there as ways that we challenge our assumptions about why we're reporting and why we're doing our communications to begin with. So as we mentioned, one of the things that has been extremely frustrating is the way that our communities have been encountered as one that either started with a tabula rasa and had no issues prior to the pandemic, but also when we talk about the history of health disparities, it usually is just captured in those 3 or 4 words with no deep dive as to what we mean when we say mistrust and distrust, right? And so I put here also known as critical race theory because most of us were also not taught these things in school due to contrary belief. Critical race theory is not taught on a wide scale level. And that is problematic because then that often means that the experiences of those who are the most impacted have their voice. It's almost like an us against them. It's their voice and also history that has to compete with other spaces that are not trying to censor that history. So this is just a very quick rundown. I teach a course called African Americans and the Law, and we spend a little bit on the policies that were actually put into place that were intended to not only discriminate, but I want us to think about what it means when you have policies that still have long-term impact on our bodies today and how even some of these practices still show up through the stories that many of you all have reported. So some snapshots include, I like to start with the fact that when we talk about slavery, we often do not talk about slavery as one that is also a disability rights concern or a disability issue. I like to talk about slavery as one of the largest contributors to disability in this nation, largely because we do not talk about the way that whippings are not only harm the body and rip the body, but that also means that people had to go back and still work, right? So we are talking about individuals that have been maimed, individuals that have been hurt, have been cut, and oftentimes their bodily functions and bodily movements have been impaired, but that did not stop their obligation to have to still show up and produce. And so when we think about what that means today, when there's skepticism about public health and public health's intent to actually make our bodies whole, I want us to also think about this is a long history of lack of, at best, negligence, and at worst, willful intentional harm inflicted on our bodies. When we move further down through this list, and I won't go through all of this because you all will have the slides, there are a couple that a couple historical policies that have come into play that have also been under discussed, including mass sterilization that not only happened here in the United States, but also happened within the islands, and of course, Puerto Rico being a US territory, also experienced mass experimentation on young women that resulted in the creation of birth control, what we now call birth control pills. And also just put Onsimus and that's his image that's here, and his smallpox inoculation discovery, which actually has been accredited with being the earliest form of vaccinations. So when we even think about the historical connection of vaccinations to our communities and the opportunities to use communication as a way to affirm the inventions of those who have been marginalized, we are not talking about how our historical and medical inventions that are connected to COVID are a direct connection to those that have been impacted, right? So how are we trying to bring communities in? How are we trying to invite them to be a part of the story? And also, how do we also affirm the ways that they have intentionally been harmed? Does have a timeline that communicators can play a huge role in supporting and the amplification. But as mentioned when I started, there is a daily pre-COVID health, there's also a contemporary pre-COVID health data spreadsheet that we continue to suppress, right? 2016 study that revealed that researchers at UVA had continued to show that residents and practitioners still held false beliefs about our biological differences, right? So one of the timeline pieces that I skipped over was a famous study. It was called the skull study, if you will, shorthand the skull study, that argued that because those of African descent had smaller heads, therefore they had smaller skulls and smaller brains than their white contemporaries. We see that in this study, we still have practitioners who believe that we don't experience pain the same way, that we have thicker skin. And that is not necessarily just for non-Black and Brown practitioners. That is something that has continued to show up as a presumption of the different characteristics based on race. There are also reports that highlight the different treatments that doctors reported giving to Black versus non-Black patients, with the assumption that Black patients need diagnoses that are quote unquote simplified to ensure that they would actually take whatever the advice is from doctors. And then of course we have the complete non-discussion within active discussion in public health spaces and medical spaces around what does it mean just to be Black in America? What does it mean to be brown in America? What does it mean to be immigrant in America, disabled in America, queer in America? And how does that impact your health? And so a report by the Commonwealth Fund discussed how there's almost like this willful, just not so much denial, but non-discussion or non-inclusion of those daily realities into the conversations of what it means to be healthy. And therefore there is a mass, almost like a segregation between those who experience it and know it to be true, and those who have a completely different experience as to what it means to be healthy in society. So want to just highlight those two things because oftentimes when we're thinking about communication, we are quick to jump into this space of we want to go ahead and we want to get people the information to do a particular action. But the reason why our team at Pink Cornrows really focuses on truth is because of studying practices such as truth and reconciliation, which has literally brought upon mass conflict resolution in spaces of war. We do think that there is a more discussion as to the power of truth in communication versus just sharing data as a form of motivation to change behavior. One of those assumptions that we hold is that the truth, especially within Black communities, but also we see this in immigrant communities as well, and individuals where English is not their first language, that our truth is historically second guessed. second guessed at best, ignored, or even dismissed as not being truthful. And so that as a starting point is problematic. Not centering truth results in more harm, as there is not only a lack of acknowledgement of history, but there is no promise of a different outcome on the other side of this. So when we think about the COVID-19 messaging that's happening right now, we are consistently seeing communities say that there is still a persistent issue with everything from access to PCP or a primary care physician, having inequitable care for doctors that have specialties. Obviously, we still have an access issue to certain programs like Medicaid and Medicare, and yet the focus of the conversation is on vaccination, with no mentioning as to how there are these ongoing and persistent barriers that are happening within communities that have a current lived experience with inequity. And so we proffer that until lived experiences are also considered just as credible as data, that the latter will usually be encountered with healthy skepticism. And we say healthy because there is a timeline that actually warrants a questioning of what exactly are the motives behind, are there even motives behind vaccination? And for communication specialists, we are hoping that this is an opportunity to do a blended form of messaging that holds the realities that communities are experiencing versus pushing that to the side or ignoring it as a whole. And want to just highlight that data is often a tool of those who are in power. So we just went through a timeline of data points that are often not shared broadly, right? So we also want to highlight that data that is data that disproportionately impacts any group of people that continues to be ignored also means that the communication behind that data continues to be ignored. And therefore, when we talk about mistrust, distrust of communication, there is also skepticism for those towards those outlets that are purporting to either know all of the truth or share all of the truth, when there are communities that know that they're experiencing certain realities that aren't even being shared. And as far as the communication, as far as the goal, one of the goals that we try to work on is how do we multiply the frequency by which communities are heard, validated, and also where can we invite them to control their own narratives, right? Without necessarily trying to get them to do what we want them to do. And so one of the responses that we had to the COVID outbreak was we started checking in. I personally, my mother is an essential worker. She is still working 90 hours a week. She did contract COVID at the end of 2020. So did my father, and so did my youngest sister. And all through 2020, there was this heightened frustration that I had about even the disparity of what type of essential worker was getting attention, and what it meant when, for about a couple months, there's this, there's this very little known information about this pandemic. And then when we start hearing reports, anyone who was connected to the community, you heard murmurings of, well, who this is gonna impact the most. And sure enough, what we started hearing were the numbers connected to our casualties and how many people were hospitalized. What we weren't hearing were the experiences of those that were hospitalized, or the experiences of those who had loved ones that were harmed. So our team at Pink Cornrows, we launched COVID While Black, and then eventually also partnered with NBJC, the National Black Justice Coalition, to do COVID While Black and Queer. And it really kind of challenged how we defined data, even for our team. We wanted to make sure that communities were not just reporting on their illness, but that they were also reporting on their fears. They were reporting on their strategies around policy. And we also wanted to hear what people were the most fearful of. And there were several insights that were raised, but before we get into the insights, we also created a space for people to honor those who had passed away. We do know that there were some people that participated in our survey that are no longer here with us, but we recognize that there are traditions across various communities, especially communities of color, indigenous spaces of color, that felt like there was something kind of missing in the narrative around the pandemic that wasn't inviting people in to participate even after they had lost a loved one. And we were trying to create a little bit of space for that to not only exist and to happen. We also wanted them to know that we recognize there was a partner that recognized that this pandemic is not the only pandemic that they're experiencing. There were some colleagues in the UK that had caught wind of this, and we actually partnered with each other and did a global conversation with Black, Brown, and immigrant persons to talk about how the narratives around COVID were not supportive or fully transparent of our experiences. And it was interesting, in the UK, they actually built a movement challenging the BBC around the lack of attention of specifically Asian and Black and both Caribbean and African essential workers who were the first ones to die in their hospitals, but coverage didn't start until white essential workers were starting to die. And that's when BBC responded with more coverage and more amplification of the racial disparities that were connected to the coverage of COVID. So though that was just kind of like our beginning intervention point, both as people who are connected to the community, but also as individuals who were interested in hearing how communities were dealing with the pandemic. To no surprise, when asked how they would respond policy-wise, people weren't just waiting for the vaccine. People had raised issues on housing, on education, on employment opportunities, and wanted there to be a longer systemic conversation about, so we know that things are broken, but if there's a broken healthcare system and we're talking about this broken healthcare system, are we talking about repairing the healthcare system, or are we just talking about the vaccine? And I think that's going to continue to be a conversation of concern moving forward. So right before, this is going to be a great segue to bring in Aurora and Tia, because some of the top-line insights that we are still referencing even today include that the distrust and the mistrust that's happening is not just a feeling or a condition of ignorance or a remnant of the past. There is something about how communication needs to kind of talk about not only the ongoing issues of mistrust within communities, but how it should not even be seen as a separate conversation, but one that could potentially invite more communities that are still experiencing inequities with their day-to-day needs across a range of social determinants of health. Some reported that the survey was the first time they were asked how were they, which is also to really think about how the communication could be seen as either harsh or sterile, and not necessarily people-centered, even though we use language like people-centered. It's interesting to hear what the impact of the messaging has been on communities. Influencers for them included familiar local faces and those with relatable lived experiences. And so that's a conversation that I really would want to dig deeper with Tia and Aurora as to who are the people that we are either paying or promoting to be the messengers within our communities, and what are the ways that we can shift that. Collaboration about solutions was not the norm. We had folks in Detroit who were janitors, peers of my mother who were nurses, who had stated that they had never been invited to talk about what policies they are looking towards to moving forward, right? So keeping in mind that people are seeing themselves not necessarily as in a post-COVID society, but in a society that actually includes them in health solutions in a different way. And then finally, this space to acknowledge harm and grief. And grieve, was deeply needed. And there's still an opportunity as people are still, passing. What does that mean as we're communicating? Even if we have a 15-second slot on a radio station, what does it mean? Like, what are we saying that could simply just be about connecting with those that are still dealing with the loss of loved ones? And then finally, with the current effort that we are working with Rockefeller on the Equity First Vaccination Initiative, there were obviously some top lines that I'm sure you all are seeing in your work that are continuing to resonate. One of which is just flat shaming doesn't work, right? That language like the pandemic of the unvaccinated was seen as not just harmful, but also inaccurate. As we're seeing breakthrough cases, there's still a lot of questions around how we are framing who are the quote unquote spreaders or holders of the vaccine. There were communities that were communities are still concerned that they are being demonized for a much broader public health concern. And all those who are not vaccinated aren't necessarily equal. Two things that have come up, right, is that people are still researching. There are high numbers of individuals that in Baltimore, I love the term that they have created, which is the slow yes community, communities that could potentially say yes, but they still need more information. Very well aware of the statistics around who's getting sick and the impact of the virus, but also still very much want time, right? I also think that we do not talk enough about how the side effects of the vaccination is a real concern. A lot of discussion as to whether or not communities can afford to take 2 to 3 days off for potential side effects, including those who are on the ground providing the information to community members. So something that we should think about as far as our mass public information sharing. And then the space for nuance is needed, right? Communities not only need to be respected as survivors of this pandemic, but of multiple pandemics. And some of those issues have not been addressed today. So there is some residual hurt around just inequitable public health spaces that the pandemic or the virus, the vaccination and the response to this vaccination, as opposed to the response to other existing pressing health issues, feels like a disparity even within itself. And so I want to invite Aurora and Tia, because some of the opportunities that we have are around how we continue to promote care and safety, regardless of how somebody feels around vaccination, promoting more local leaders, and then also being a little bit more being humble around what we do and don't know about the vaccine, and seeing that as actually a powerful, truthful, and authentic way to connect with communities, versus shaming communities or having an unintended effect of shaming communities that are still trying to get more information. And so want to turn this over for a bit of a dialogue with Tia and Aurora. Aurora, who is in Houston, and Tia, who is in Baltimore, both of which are communities that are also a part of the Equity First space. And so I want to gut check myself, because I could be completely wrong with everything I just said with that presentation, but I want to hear from both of you. And I'll start with you, Aurora. When you are hearing, as far as what are some of the concerns about messaging, especially to young people on the ground, what are some of the things that you're hearing, or what are some of the things that you're seeing that are just not working, or maybe are problematic when it comes to trying to reach younger communities?
Yeah, thank you for that. And thank you for that wonderful presentation. I was taking notes. I feel like I learned a lot, and a lot of it deeply, deeply resonated with me. So I'll just share a quick story. Out in Sunnyside, which is a low-income community here in Houston, Texas. And the community center hadn't been responding to our youth who were trying to put together a field day, kind of like a Squid Games fun field day if y'all are watching Squid Games on Netflix, which is problematic in and of itself, but we'll try to let the young people lead, right? So the community center is not responding. And so I'm like, all right, I'll put on my like director hat, I'll step in and we're gonna figure it out. So I'm like, we probably should just go in person, right? So like off the bat, I'm like, and not everyone finds email and phone calls and Zooms accessible, and everyone works that way, right? So I think that in and of itself was kind of a barrier. And then I get to the community center and amazing young Black folks, they're like leading the after school program. They're in mask, everything's going great. And I'm like, I need to talk to the leader. I want to talk about this vaccine campaign. I'm with Young Invincibles. I gave the whole speech, young people, blah, blah. And the first question they asked me was, are you funded by white people or were you funded by Black people, right? And I had to reckon immediately with the fact that my organization was funded by white, middle class, Georgetown law students. That's not what our organization is today, but I think the piece in your presentation around reckoning with your own industry really resonated with me, because I had to immediately answer that question, and I knew exactly why he asked it and what he meant. And I knew what my response was gonna be, the kind of where the conversation was gonna go, right? But that was the first question he asked before I could even talk about the event, what I wanted to do. Well, were you funded by white folks or Black folks, right? Were you funded for us, or what's going on here? And so I'm honest. I'm like, yeah, we're funded by middle-class white college students. But as you can see, right, like things have changed. And I brought youth from the neighborhood with me who were trying to put on the event. All of us, of course, are Black. And I honestly think if we had been any other color, it wouldn't have worked. Like us just physically being Black and physically being able to tell the story of Young Invincibles face to face, and being able to like acknowledge our own history. I mean, we're only 10 years old, but like that is just a small example, right? I can't imagine orgs who are 100 years old, or folks working on behalf of the CDC, oh my God, government groups, whatever, but like we had to reckon with that, and we're only 10 years old. And so it was just a really powerful moment for me. And I immediately went into sharing my vaccine story. I mean, I think whenever we are approached with those types of questions, I think, like you said, definitely be honest and be humble, but also share the story of how you yourself are vaccinated. I think that has been one of the most powerful tools that we have at Young Invincibles anyway. A big tactic of ours is when folks start coming at us like that, acknowledge it, because you're absolutely right. It's there. It's always going to be there. Shaming doesn't work. Telling our communities we're in a crisis now doesn't work. We're always in a crisis. And so really, we just have been like sharing our story. Can we give you some information, right? Mm-hmm. And like I said, we hope that that becomes a slow yes. So the folks who like money is a barrier, transportation is a barrier. We try to address those things. But for that community, that's what we've been facing. And so our work is being directly in the most unvaccinated Black and Latinx communities in Houston. It's been really difficult to do messaging. There's no one trusted messenger. There is no the top things that we've been seeing is I want to speak to a medical provider. And that's largely because our communities are very much uninsured, especially in Texas. We have the highest uninsured rate in the country. You'd be surprised how many people have not spoken to a doctor in years or a medical provider in years. So that continues to be like the big trusted messenger. And then again, like seeing someone who looks like you share the story of why they got their vaccine has been the two most effective pieces. And I hope I answered your question. I went into a rant, but like no, your presentation just kind of reminded me of that story and kind of like what happened to me.
Yeah, no, thank you for that, Aurora. And if I can be very transparent on this recorded conversation, so I'm a little scared to even say this, I just finally got a PCP last week. And my reason for not getting a PCP for a couple of years was because I had a very traumatic experience with my last kind of like encounter with the medical space. So to your point, there's a range of reasons why people are hesitant to really connect deeply with just one messenger. I loved what you said about just the honesty about there is no one right now, at least in Houston, messenger that people are getting all their information from. And Tia, I want to invite you in to this space to share also, what is working, what isn't working, and if you can also touch a little bit on the influencer conversation, because that often comes up with young communities. And if I'm honest, if we're honest, Black communities as a whole, Brown communities as a whole, because of our connection to both digital spaces, but also entertainment. Would love to hear from your perspective what is actually working, but also what may not be working that communicators are using as part of their strategies.
A little bit. Okay. Thank you, Ira and Miss Iffy. Everything you were saying definitely resonated with me, and it reminded me of a story that I also want to share. A little bit about me first. I am an acting major at Towson. I'm a graphic designer at Wide Angle, and I'm also a photographer. So last week, I just did a photo shoot with Wide Angle and some other organizations with Baltimore versus COVID. And we got some influencers like Nada. I don't know if you guys know about her, but I love her. She's a famous Baltimore rapper. She was on the Rap Game with Jermaine Dupri. So she's really big. I love her. So I got to take pictures of her and video her. And, and she's vaccinated. And I got to hear why she got vaccinated now. Before I was vaccinated, I used to work at Dunkin' Donuts. And this older Caucasian gentleman comes and talks to one of the employees. Now I'm minding my business, I'm cleaning up or whatever I'm doing. So I walk by and he's like, "Hey, you are you vaccinated?" Yeah, I'm the only African American woman that works at Dunkin' at the time. And he's like, "You vaccinated?" I was like, "Huh?" And he says, we don't hurt the African Americans no more. We don't do that no more. You shouldn't be scared. Mind you, I wasn't even in the conversation. I was walking away to go mind my business. And he's like, "We don't do that to the African Americans no more. We don't hurt you guys no more. So you should get it. You should trust it." And I'm like, really uncomfortable because one, like you were saying, Miss Iffy, in the presentation, how we need a space where we can grieve. Just the other day, something traumatic happened on the news. It's like, it's not something we don't do anymore. It happens every day, So him saying that made me very, I'm thinking about getting the vaccine and you're saying we don't do that no more. And I realized people are harmful every day to people in my community. So it rubbed me really the wrong way. Now, that didn't influence my decision a lot on why I got the vaccine, but it did make me consider, is this what I want to do? That messenger, him being a messenger, really affected me. Now, I got the vaccine now, I'm on campus, and I heard Nada's statement on why she got it. And it changed, coming from someone who looks like me, she's also a young Black woman, someone who looks like me really, and who was comfortable, made me feel more comfortable instead of hearing, we don't hurt you guys no more, you African Americans, So that's my perspective. It does matter who's saying it, how they're saying it. If he just said, if he said anything else, but saying, you African Americans, we don't hurt you, it's like, why are you saying it like that? The messenger, what they look like doesn't matter in my opinion, but what they're saying, what their view is, their bias comes out in what they say. So it's kind of important to eliminate bias. And that's when we talk about equity, it's impossible to eliminate all bias, but try to work past that. And we can form equity and we can all grow as people, not from based on how we look, where we're from, what organizations we're with, but who we are. Are we good people? Do we want what's best for everyone? That's all.
Wow, that's super, super powerful. And as we invite people to either share their questions, or Nina, I don't know if they're letting you know if there are questions. One of the things that we want to ensure that we're doing is increasing how we problem solve in real time with each other, right? Oftentimes when communication is created, it's with a small group of people behind a closed door, there may be some insights that come from polling or some information, usually there is, in a lot of spaces, especially in traditional spaces, we are kind of brought in after the fact to give our response to what has already been created, or there is this conversation around lived experiences, which I now question as to whether or not the lived experiences are actually, if that's informing how we communicate better, or if spaces are just using lived experiences because it's all right thing to do, right? But it's not necessarily informing how we change our practice. So really quickly to both of you all, if there are practices that have been really helpful in allowing for communities to either share information or to bring communities to the table. Would love for you all to share anything either you've worked on or anything that you would encourage those who are on this call to maybe integrate earlier on into their communication strategies, because I think that's really, I think we're starting to get into that space where we need support for the slow yes community. And that means that we need to find different ways of creating communication tools and maybe even communication messages. So whoever would like to start, I would love for you to jump in.
I have an idea. So everyone knows the saying, if you see a dog and you run, the dog is going to chase you. It's kind of similar when it comes to saying when you're arguing with someone, if you come off defensive, they're going to run away or they're going to chase after you like, no, 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 no. I feel like if we come from a place, like I said, without bias, without judgment, or a lot of people do the banking approach where they just give information. But if you come from a place of maybe humor, comedy, everybody loves to laugh. It's like, oh, that is a good point about the vaccine. Like, I see where you're coming from. And that's where conversations can start. Hopefully that makes sense. Just being open, not just I'm right, you're wrong.
Right.
Yeah, I was actually going to say something similar. So I think our communities have been through a lot. We have all been through a lot on this call. Let's acknowledge that, okay? This is very hard work. And so as much as we can center pleasure and joy, I think you should go for it. We have hired artists to do like illustrations for our work to kind of bring some of our events to life. Some of our in-person events, they're outside, but we've done, things like loteria in the park. We've tried drag bingo with like questions about the vaccine, right? So we are trying to spark joy, happiness, humor into the work. If you look at young people and their TikToks and Twitters and things like that, just as much as they are informative, they're also hilarious and want to dance and do fun things. And so I think like let's not forget that, that is something that really does bring people to your social media and to your messengers.
And I see that there's been an invite for people to share questions. So we will also include those as they come up. One of the things that came up earlier in around August or September was the conversation around how young people are still experiencing, in some spaces, gun violence, right? In other spaces, housing insecurity. And of course, for students that are getting back to school, they've also spent 18 months not being in school. And especially for those that were either on their way to graduating or supposed to graduate, there are a whole host of other health and wellness issues, mental health issues that have come up as well. So wanted to just hear a little bit from an equity standpoint, advice as to how reaching communities that are still experiencing multiple pandemics, what strategies either could work or even just sharing with us, some of the problems with having messaging that doesn't speak to that really shared, regardless of location, dilemma that we're seeing across the country and probably globally.
Yeah, I mean, I can try. So we work with primarily college students. To your point earlier about changing who the narrators and trusted voices are, we've hired Black and Brown young people from specific unvaccinated neighborhoods to do and lead the work. And we primarily train them online on, traditional tactics like canvassing, text banking, storytelling, and things like that. And what we found is that a lot of young people are like, this isn't working for me. I'm just staring at the screen. I'm getting it, but I'm not retaining it. And we had to just really honor that. And we had to make a decision as an organization to say, we've got to find safe ways for them to connect off of Zoom. And also they were telling us, look, my peers, we outside, like we want to reach young people. We can't just text bank all day. And so we've just really had to be quite honest, just really figure out how do we safely meet again? How do we safely do our organizing tactics again? Of course, we're doing digital and in-person hybrid, but I think that has helped tremendously. We have had youth, like to your point, one of our young people actually was kicked out from his home for coming out as trans. And so we're having to figure out like how to support our youth organizers as they kind of do this work. And another thing that we've done is we've embedded health and wellness hours. So like they're all part-time. I don't know if folks on the call have hired youth organizers for their work, but you know, when you're part-time, you don't have the same luxuries as somebody who's full-time to take off, you know, sick leave or mental health days. And so we've embedded that into their hours. Like it's already built in for you to have some mental health care space, and it's not going to affect you getting food and transportation and gas for your, you know, your paycheck. It's already built in. So we're already thinking of like small ways that we can continue to build in health and wellness as a culture into the organization. And I mean, we're just honestly doing the best we can. But those are some tactics that we've been using so far to kind of help. And Tia, I don't know if there's anything else you want to add.
Yes, a little bit. I'm currently on campus. I don't live on campus. I commute, but my freshman year was on Zoom. So mind you, I'm just starting college, so Zoom school is all I know. Now I'm a sophomore and I'm finally on campus, and it is extremely different. Now, it's the thing is during the pandemic, all my friends, they lived on campus, so they were out of state. So I had no friends at the time, and you know it's hard to make friends online. It's pretty much impossible, but school was easy. And I like that I'm an acting major, so they're really like, and they're very, you know, they try their best to be inclusive and as much as you can over a screen, you know. But in person is much better because I felt bad. Well, I'm learning that people who was here already had to go home short notice. Now, not everyone is from Baltimore, don't live in Maryland. So they had to immediately find flights or stay with friends and things like that. And so now a few of my acquaintances have gotten apartments off campus because it's safer. You know, it's safer and it's more convenient. So that's sad to hear that they can't even live on campus because they're scared they're gonna get kicked off and not have nowhere to go as they did before. Luckily, I didn't have to experience that. But now I'm experiencing, you know, feeling not comfortable coming on campus one day because maybe someone in my ensemble has had COVID and I'm like, oh, should I come in? But I have to because it's a grade. You know, we're dealing with that now. So it's just, there's no good balance. I mean, I like in person. Zoom school is easier though, but you know.
Nina, I know you had a question for us to wrap. Yeah.
Yeah. Oh my goodness. This time has gone so fast. Thank you all so much for everything already. In our last 7 minutes, just a couple last questions for you all. We're definitely hearing a theme, certainly in this session and across other recent sessions in this webinar series, about the importance of inclusive messaging. Obviously, messaging that leaves room for discussion and conversation. Obviously, this takes work. So I'm curious about two things. One, your perspective on why that doesn't happen. Why do we as communicators or the public health communications community, why do we default to telling others what to do in a shaming or scolding way? And then secondly, do you have more suggestions on how communicators can weave inclusivity more into their process before messaging and during messaging?
Tia, Aurora, do you all want to jump in?
For the first question, I have some thoughts. I got to think a little bit about the second question. But for the first question, why do communicators tend to come off in more of a scolding way? I think it's because confidence is key. If I'm confident about something, you're more likely to believe me. But then I feel like that confidence turn into a type of assertive or like cockiness to it. So if I tell you, I have blonde hair is the way to go. It's the only way to go. Now it seems like I'm being condescending. Like I like blonde hair, but it's not for everybody. Or if I differently say, you know, blonde hair has this pro, this pro, and this pro. I love it. What do you think about it? Including other people in the conversation, I feel like that doesn't really happen, especially when it's kind of hard to include other people though, if you're just trying to get a message out, but you still can. You know, you don't have to just be like, I love this. This is a great way to go on a campaign poster. You can also be like, you know, I feel this way. Write down what you think on the poster, and then other people can read it on the poster. You know, it can be a little more creative than that. That's my idea.
Yeah, and I'll just piggyback on Tia. I mean, to your point, nowhere in our culture is it rewarded to be inclusive and nuanced. So I don't think communication is any different. I think that that's all we know. Like Tia said, it's better to come across as a know-it-all because that is what is rewarded in society broadly. So I think that that's kind of why that's happening.
Yeah, and to build upon both of those things, um, I want to, at first I want to center kind of how we started this, which is like the history, right? Every industry, we are in a opportune moment that many of us, as activists, as people who have marched, as people who sometimes feel like you're hitting against the wall, you want people to be reflective about the history that we have experienced and the one that we're experiencing. And that also means that every industry has a history, right? So public health also has a history. It is connected to the combination of various institutional spaces, medicine being one of them, right? And so I love the way Tia raised that how even information that is helpful for us, it's not just about the information, it's the delivery of that information that oftentimes can be both jarring and in the space of public health, where we still see disparities as to who is in schools of public health, who gets to teach schools of public health, how the insights are nuanced with the history of communities that are the most impacted, and how we continue to have systems that have individuals that come from privileged communities speaking about and on behalf of communities that have actually been impacted by the things that they're teaching on, right? And so there is this huge gap still as to like teacher, podium, person with power, and then recipient of the information that we've created. And that's in all spaces. I find it even in spaces where I teach, or even as an attorney, I am questioned because of all the things that are not connected to knowledge, but connected to bias. So to your second question around inclusion, two things, I mean, as we raised earlier, intentionally, Tia is absolutely right. You can't erase bias, but you can mitigate for it, right? And so when you invite people to participate in any type of communication strategy is key, because you can invite people at the tail end, slap on the inclusion sticker, and that's not necessarily inclusion just because they are present or that they participate. It is really important for us to create strategies and then take a step back and really think about where are the multiple opportunities that not only we could be wrong, but are we even bringing in people that do we expect to be challenged, right? Are we actively creating spaces for our assumptions to be tested? Because often in spaces, even when there's inclusion, there's still a power difference. And we don't talk a lot about power when we discuss equity, and power is an extreme, that is not only extremely important, that's why we're seeing spaces that hold themselves as D&I spaces or whatever you want to call it, still lagging because nobody wants to necessarily give up decision-making power. And then finally, I should think about, we have recognized that, yes, the goal is to ensure that we save lives. We all say it, that like we want to save lives. And I do think that there is a very positive intent about, we want to make sure that people that have experienced this harm get what they need, because I do think there's a bit more of a recognition that these communities have been wronged, and they've been wronged for a long time, and they really need this both information and these vaccines. I know that there was a question that was raised around how can privileged spaces, how can they, work on integrating and connecting better with communities of color and communities that come from different backgrounds. I do think that one of the strategies that we raised at the beginning is like, if you have the resources and it takes time, because you're not going to really get around the time that it really takes for communities to come to their own conclusions, then put your resources behind creating as many spaces that are safe, as many spaces that have the resources to answer any question, as many prepared individuals that are willing to go down the rabbit hole of the debates, as Tia mentioned, and as the storytelling that Aurora led, we all actually led with stories. So people that come from stories need space and time, they need validation, they need affirmation. That is not connected necessarily just to data and facts, but what they are saying is true, right? So we need more spaces for truth, and we don't have to be right, right? But we do need to be rightful allies in creating and responding to the needs that are coming from communities, not the other way around.
That is an incredible way to close this session. I have just been like nodding vigorously for like an hour, so my neck kind of hurts. But yeah, all of you, thank you so much. Thank you so much for being frank with us and just sharing your stories, which is always a vulnerable thing. I'm going to pass it on to Caroline for some last announcements here before we close out.
Yes, thank you all so much. And thank you for your attendance and participation for today's session. Just a note that usually we would meet in 2 Wednesdays from now, but I would like to invite you all to our end of year reflection session on Wednesday, December 1st from 4 to 5 p.m. Eastern. It's been a little over a year since we've started this communications community practice, and we'd like to end the year with a recap on why we started this community, hear from some past speakers and some updates on their work, and to hear from all of you on what has been helpful, what you'd like to see more of, and to hear some examples of how you might have used the findings from these sessions in your own work. We hope to see you on that Wednesday, December 1st for our last STAT Communications Community of Practice webinar of 2021. And in the meantime, please have a safe and wonderful holiday. As always, thank you for your time, thoughts, and being a part of this community on behalf of Hadaway, the State and Territory Alliance for Testing, and the Rockefeller Foundation. So thank you all again. Slides and everything will be shared in a recap email. Have a great rest of your Wednesday.
Bye all.